most of them, including me, will hear about water birth. Ano ba itong manganganak ka sa tubig? I mean,
Oo.
is this an option, a choice, advantage,
Well,
disadvantage? And yes, what is water birth?
Water birth is basically laboring and delivering in warm water, no? So, I've delivered this lecture several times to the American Chamber of Commerce, to the Makati Medical Center also. But basically, water birth is something that has been going on for quite some time. As far as history is concerned, the first documented case was 8000 BC. The Egyptian pharaohs used to be delivered this way, no? And then in relatively modern times, the first Western delivery was in 1803 in France. Because they had a very difficult time, the mom was so exhausted and in pain, so they decided to put her in warm water. And they found that she was able to deliver and she had a lot of relief. So it was started, the founder is a Russian, Dr. Igor Tchaikovsky, but he used cold water. The one who started the modern version of it was a French obstetrician called Michael Odent. So he started warm water births in around 1977. So this is not something new. It's been around some time, and in fact, in the United Kingdom, they about 30% of these deliveries are water births already, no? They're trying to encourage this kind of thing.
Around 40, 50% in UK?
30%,
30%?
yes, because they want non-medicated. If you know anything about the UK, it's their health system is NHS, so it's paid for by the government. So of course,
cheaper.
It's cheaper. It's definitely cheaper to deliver by water. Why? Because you have no supplies, you have no anesthesia, and it's something that's remarkable. Once it works, it's beautiful to see. And this is the ultimate empowerment for women, because when they deliver in the water, we just deliver, but they do everything. So it's really a major accomplishment on their part. Nowadays, a lot of women are using it na parang bucket list, no? So it's
a bucket list for them. At
yes,
least one
yes.
water birth.
Well, yes. It has several advantages also, no? For example, this is not a fad thing, but it has several advantages. First of all, when you're in the water versus outside the water, there's a lot less pain compared to a lot less pain compared to non-medicated. Secondly, if you're in the water, yung uterus floats. So that by the uterus floating, this means that the circulation is much better. So usually there's a lot of pressure on the woman's body. But when they're in the water, they're buoyant. So this one goes up and all the great blood vessels are able to flow. So you have better circulation. Plus the woman is able to adopt any position in delivery. That's why a lot of doctors are hesitant to do this, because the position is variable. They can deliver the usual lithotomy position, or on all fours, or sideways. Lithotomy is the usual position, leg up, no, in front. Then they can deliver in different positions, because the woman is weightless, so she can assume any position. Also, the warm water, there's never any incidence of drowning, because humans have what you call a dive reflex. That's why it's important to have a facility that can control the water temperature. As long as the temperature is above 37 degrees, paglabas ng baby, the baby will not drown. There is called a dive reflex, so the baby will not gasp unless the baby is exposed to air or the temperature drops. Then the baby gasps. They have noted that the babies also do a lot better. They are more eager to breastfeed. They are able to suck well. They have better eye contact with the mom. So it's a more gentle form of delivery, no?
So everybody, or is this only applicable to some women?
Okay, since the woman is doing everything, she has to be physically fit. So typically, they have to be in relatively good shape, because there's no, basically during the entire labor process, sila lang, no? They don't have any help, they don't have any IV, but they're allowed to eat. Okay, and then The
no ID.
no IV, no medicine talaga.
No medicine.
In fact, when they deliver, there's also another advantage is since it's warm water, there's hardly any tears or any lacerations. In other patients, we don't even have to do anything. Okay?
What's the connection being underwater?
It's
and
warm water.
In warm water
Yeah.
and no tears.
Well, it's warm water, so the elastic tissue becomes more elastic, so there's less tendency to tear. So we don't do episiotomy. We just let her deliver, and most often there's less tearing, really. No.
Less tearing. Okay. So, are there contraindications? Who
Oh
can
yeah.
undergo
Well,
this
of
one?
course, if they have medical conditions like hypertension or twin pregnancies, because there's a tendency to bleed, infections, severe asthma, other things. So basically, the woman has to be very physically fit. Now, they don't have to. With the facility that we have, you don't have to, complete everything in case they're not able to handle it, or in case there's really a medical indication. We can move her 10 feet away, and then she can already have epidural in case it's needed. No, this is the water immersion facility at the Makati Medical Center. So that's the entrance.
Yes, where you practice.
Yes, I also practice in St. Luke's Global for water delivery.
So, Martin, this one is named after your...
My uncle, this is
Your
CP Manahan Pavilion because, well, that was his whole life. No?
And this is the...
This is the entrance. This is the entrance to the water birth room. This is where we keep like the other people, like the mom of the patient. This is the water birth. This is a bespoke tub. And that is a birthing stool that's very, very helpful for women in labor, no? So this tub is actually made really for water birth. You can see there's a television there. In the later pictures, they have a Bluetooth system. So in case they want to, after delivery of the placenta and the baby, they move here to the bed, no? So it's there. This is the whole view,
the
no?
whole view.
So it's really an excellent place. If you like, you can make it very personal. So we don't have a whole bunch of nurses there. It's just a doctor, myself, the husband, and maybe a doula who is a birth advocate. Okay?
So, what are the advantages of water birth compared to NSD?
Well,
I mean, for
for-
some pregnant women who are thinking, deciding, is this for me?
Well, it's a remarkable thing when it works because really there is better outcome with the baby. There is better outcome with the mother. As in, we don't even have to give pain relievers afterwards. Okay. Secondly,
so no pain relievers, no injection.
none, no injections, nothing. That's why the total cost is a lot cheaper because there are no supplies, there's no medication, there's no operating room. But my emphasis is that if something bad happens during that labor, they can attend to the patient immediately. And this is the advantage of this facility. No? There are a lot of women who are delivering at home. That's really their choice. However, as you well know, if it's a traffic situation and something bad happens, you want to make sure that you can do emergency services. So with this one, this is the fastest reacting delivery room. And you can do, like, they can prep for anything.
Few minutes.
Yeah, it takes them about 10 to 15 minutes, no? Because they're already, when you hear that there's something going on, they're already prepping. So they're very, this was the style of my uncle, no? It was very efficient and very quick.
Are there other doctors in the Philippines?
There are several doctors who are doing this, and not too many doctors want to do this because when the patient is there, you really have to make bantay. As in, you're there the whole time. Siyempre, you cannot really monitor, you cannot rely on the resident to do that because what happens is most of the time they rely on the resident to monitor and then they just call the anesthesiologist there monitoring also. In this case naman, no, we're there talaga. We have to make bantay talaga ng patient to make sure that nothing's going on. Yung monitoring kasi hindi pwede hook sa fetal monitor. So what we do is we have a waterproof Doppler and then we listen to the baby, no? So it's really a very intense but very personal thing. So as I mentioned earlier, if you want to make it personal, we can limit the number of people there. We can dim the lights. You can have aromatherapy. You can put rose petals there. You can put your own music. You can have a doula, who's a birth advocate, no? Somebody like a cheerleader for the patients.
May ganun pa.
Yes, there are a lot of doulas who are practicing now, no? So they're the ones who help the patient through the process.
But for you, what's the main advantage of this? It's less pain or
Well, it's less cost, less pain, but it's something that for me naman, it's not what I want. It's what they want. So if the patient wants this kind of delivery, I will make their wish come true, really. I'll make sure that they're able to deliver and in as much safety as possible, no?
if they want normal delivery,
Yes,
it's up to them.
yes.
What's Lamaze? I'm not that
Lamaze was
famous before.
yeah, it was famous before. Basically, it was non-medicated delivery, but it's outside the water. So I have I have this patient who is a U.S. Army captain who's an American missionary. Then she had 2 Lamaze deliveries in Honolulu. Then she had 2 water births with me. The water births were so much better for her. No, a lot less pain. There was less tearing. The recovery was wonderful, and the kids had good color and a good suck, and they grew up to be good kids.
But of course, they cannot just do it in the bathtub.
Some people do. They have kiddie
Abroad?
pools. No, here they have kiddie pools. They have heaters and all that. But you know,
With an OB.
no OB is going to volunteer
no
to do
OB.
that. Although I did that before this water birth facility was made. I did one in Makati Medical. So it's a kiddie pool, and they have water heaters. But you know, as I mentioned earlier, the temperature has to be at a certain level. So if you have a bespoke tub like this, you can maintain the temperature. Kasi yung mga kiddie pool, they're too small, and the water cannot maintain. The temperature cannot be maintained. Plus, they have electric heaters at the same time that the patient is there. So you know, you're always paranoid about things like electrocution.
So why does the water need to be 37 degrees and higher?
It has to be higher.
Than
Actually,
body
typical
temperature.
around 37.5. So higher than body temperature because it has a soothing effect on the woman. So yung mga perception of pain
sauna.
is much less. It also helps with, as I mentioned earlier, with the dive reflex. No, the babies do not drown because as long as the temperature is above 37, the baby will not gasp underwater.
Why?
It's a dive reflex because as humans, we were actually aquatic. We still have, I mean, the baby's is swimming
underwater.
right now. And when you deliver, the baby has to come from a liquid environment and has to breathe air. So yung signal that it's safe to breathe air is the temperature drop. They're not sure what the mechanics are, but once the temperature drops and the baby's face is exposed to air, then the baby gasps. Okay?
But the baby gets the oxygen supply from the
Yes, from the
umbilical
cord. Yeah, from the cord. So,
So
we
as
don't
long-
cut the cord
you don't-
immediately,
you
no?
don't cut
We
the cord.
wait until at least 1 minute or until the cord stops pulsing. Some parents they don't even cut the cord until hours after, no? I'm not sure what that's their preference. So as I mentioned, it's really what they want.
So, Dr. Martin, can you take us, how does it happen? For example, this baby's delivery. So, when will the baby gasp? What are the precautions?
Well, this is basically a natural process. We don't really have to think about it.
So the head goes out underwater.
Yes, the head goes out underwater, and then the obstetrician's only job is to deliver the baby safely. No, sometimes kasi the position is unusual. Like I've had to have the mom lift her leg and then thread the baby through, and then when the baby goes out, then the baby gasps. No, so that's the thing. It really depends on the position of the mom. So the obstetrician has to be familiar with how to deliver in different positions. No?
So when do you pull the baby up out of the water? When it is fully delivered?
Yeah, no. Well, we deliver the head, and then we deliver the baby, and then we make sure that the cord is not endangered kasi lifeline yun, no? There are some cases in the West wherein they pulled and then the cord got cut. That doesn't happen here, no?
Okay. So what do you see will happen with water birth? Is this going
This
to
is
be,
something that's going on right
increasing in the
now.
Philippines?
I think
Is this helpful in the Philippine setting?
yes. You know, not everybody is well off. So this has been going on for some time. No, there are centers in Antipolo that deliver for 500 pesos or whatever you can donate. There are missionaries in Antipolo who do that. No, so for, the thing is, these are midwives or nurses. So with this water birth facility, we'd like to give the optimal place for delivery because this is really bespoke. It's better than delivering in your house. And you have a safety net. It's safer because in case something happens, you're there already. And we can attend to them medically, no? So there, that's...
Even for breech delivery?
No.
No.
Malpresentation cannot be. Breech, you do not do that. And there are certain things that cannot be done. We do not do that in the water, no?
Okay.
For those women who are thinking of water birthing, more or less how much do they need to
spend?
Okay.
Spend?
And is this covered by PhilHealth?
Yes, it's covered by PhilHealth.
Okay.
And then I had a patient, they stayed in a suite, and all the costs without the PF was 40,000. So you have to realize that that's cheaper, no? For example, Makati Medical also has package deliveries. They have a small private natural delivery. The total cost is 111,000. So that includes the pediatrician, the obstetrician, the anesthesiologist, all the supplies. So that's discounted. If you think about the water birth, it will cost much less than that, no? They also have, well, I should mention they have a cesarean package that's 170,000 all in. This is the only hospital that has a small private package, which means that you're in a small private room. Because almost all the Metro Manila hospitals have semi-private packages, no? So make a share ka dun sa room. So there. And the nice thing is that in case you decide na you want to, in case something happens, this small private package gets converted to a CS package. No? So that's something. You have to think about costs,
sure
and a lot of
doing
people.
This for many years.
23 years now. 23 years. Not the water birth, no. About 4 years ago, a patient forced me to do it, and I have to thank her. But I'm very grateful to her for letting me do this because a lot of obstetricians, including myself, we're so used to doing certain things. And it's something new, so you have to adapt, no? But when it works, it's really beautiful and wonderful how it works.
Any advice for fellow doctors or thinking about
fellow doctors do not deliver?
Learning.
Okay. I was talking about delivery, no? Fellow doctors do not like pain. They do. They go for non-painful. No, they do all sorts of deliveries for themselves. But for fellow doctors who want to do it, we have a mentoring system. So we always can mentor them. But I've had some friends who've tried it and they've been able to do it naman. It's something that we know how to do. It's just that you have to adapt to the situation. And secondly, you really have to stay with the patient, no?
Yun lang. It's not parang time efficient for doctors.
Yes. I've had to monitor a patient up to 22 hours, so you're really there. So, you get to read a lot, you get to watch TV while waiting, and there, we really make bantay. Because you cannot assign that, no?
Any final tips, Dr. Martin, about maybe about wellness for pregnant women? Are there special tips you give them aside from the usual vitamins and vaccines?
They have to. The most important thing is diet, no? Traditionally, among the Chinese, diet is actually your medicine as well.
Yes.
But if they want to deliver well and they want to do a natural delivery, they have to limit really the amount of carbohydrates that they're taking. And unfortunately, in this country, they eat so many carbs. So they have a really big baby,
yes,
and then
what's
they're
wrong with
not.
too much carbs. The baby becomes very
The
big.
baby's too big. Too many carbs will make you basically weak. It makes you prone to all sorts of illness. So the diet should be high in fat, medium protein, low carb. Because this kind of diet, the high fat diet, the problem with fat is it's called fat.
Yeah.
So the high fat diet will provide enough hormones. It's converted to hormones to provide the baby with the correct environment. You can make
Okay.
estrogen, progesterone, all
Correct,
the other
correct.
hormones. Secondly is the fat keeps you full. So you are actually thinner
Okay.
than the others, no? And then it gives you much more energy. I'm sure you're familiar with LeBron James.
Yes.
No, the LeBron James diet is 75% fat. If you look at him, he has a godlike body and he has 25% more energy because the metabolism of fat provides 25% more energy compared to glucose. So if you're dependent on glucose, every 40 minutes you'll be hungry, you'll be eating, tapos your body will produce adrenaline to try to push the sugar up. But if you're dependent on fat, you can spend the whole day without eating.
So
Like
this,
when I make bantay, I
Yes.
don't eat the whole day. I just drink water. It's not a problem.
So yan coming from a valedictorian, so talaga
Well, I
very
also
new
I
ideas.
also use these are not really new, no. The diet I'm talking about is 93 years old.
Yes.
It's a ketogenic diet.
Ketogenic
This was a
diet.
diet that was invented for the cure of epilepsy, and it
Yes.
does work. But I also used to be morbidly obese. I used to weigh 262 pounds.
Yes.
So if I talk about diet and exercise and all those things, I have tried them all. I have studied them all. But these patients, usually they're physically fit. If they go on a correct diet, they're able to deliver the baby easy, no? Because the baby will get all the nutrients. You don't need to eat that many carbs because human beings are able to produce their own carbohydrates.
Okay. Any final tips, Dr. Martin Manahan, for those watching us right now?
So-
I'm just interested, what made you change your mind and focus on this? I think
I
Instead of
deliver
the
all
normal,
types,
all
no?
types.
I deliver all
All
types.
types.
So however you want to deliver, I will
CS,
indulge how you want. So however you want to deliver, no drugs go to the baby, okay? If this is water birth, if it's epidural, if it's CS, no drugs ever go to the baby. So the baby's awake, the mom's awake. It's my job to make sure that the two of them are safe and we have the best facilities and the best experience to be able to deliver them both safely.